Hi, I'm Dr. Brawley Wong. My pronouns are she, her. I'm a board certified family physician and I love gender and reproductive health care. Today, let's talk about the potentially scary moment when a doctor says you might need to stop your hormonal affirmation. Testosterone, just like any other medication, does have the potential for side effects. In gender affirming care, it's important that we weigh the risks of those side effects against the benefits of treatment. Now, let's go through a case and discuss whether stopping testosterone is a must, a maybe, or not necessary at all. As always, if you're experiencing any of these side effects, please talk to your healthcare provider who knows you and your health status best. Today, case number 2. Jeff is a 40-year-old man who was assigned female at birth. He has been on injectable testosterone for 10 years. His current dose is 100 milligrams of testosterone injected subcutaneously once weekly. Jeff's most recent testosterone level has been in the 900s. This is slightly higher than normal for masculine people. Physiologic or normal range for testosterone in masculine people is 400 to 900. Additionally, Jeff's cholesterol has significantly increased from prior, and his blood pressure has gone from being normal at 116/68 up to high normal or pre-hypertensive at 138/78. Given the increase in Jeff's blood pressure and his cholesterol, he now has a 9% risk of heart attack and stroke over the next 10 years. Testosterone can be associated both with increased cholesterol and increased blood pressure. Pause. In this scenario, is stopping testosterone a must, a maybe, or not necessary? In Jeff's case, stopping testosterone is more of a maybe. While it's very important to reduce Jeff's risk of heart attack and stroke, most of the time cholesterol and blood pressure will improve with lifestyle changes and by starting medications to lower cholesterol and blood pressure. Additionally, simply lowering the dose of testosterone can often decrease the cholesterol and decrease the blood pressure. In Jeff's case, since his testosterone levels had been on the higher end recently, he and his doctor decided to start by decreasing his testosterone dose from 100 milligrams weekly to 75 milligrams weekly. Additionally, Jeff sets a goal to stop drinking soda by replacing it with sugar-free flavored seltzer water. After 1 month of making these changes, Jeff awakens to find blood in his underwear, similar to before starting testosterone when he would have a monthly bleed. Jeff calls his doctor immediately since these symptoms are both uncomfortable and causing great dysphoria. At this time, Jeff and his doctor decide to switch back to the higher dose of testosterone. Even though there's a risk from high cholesterol, the risk of poor mental health and significant dysphoria outweighs that at this time. After restarting the testosterone at 100 milligrams once weekly, Jeff no longer has breakthrough bleeding. This event brought Jeff such distress that he's actually considering a hysterectomy. In the meantime, Jeff and his doctor decide to start a cholesterol-lowering medication to protect Jeff's heart while he figures out the next steps in his affirmation journey. Several months later, Jeff's cholesterol levels are coming down beautifully and his blood pressure is back to normal. Jeff would like to get off of the cholesterol medication, so he sets a new goal of walking for 30 minutes 4 times per week and weightlifting 3 times per week. So, what questions do you still have about testosterone and its relation to cholesterol and blood pressure? What scenarios or side effects should I go through next? Leave your questions and wisdom in the comments. If you enjoyed today's content, please like and consider subscribing so that we can reach a wider audience with this education. Thank you so much. See you later. Zola.